Hi guys, I'm Samantha from Oral Medicine and Radiology, Sibar Institute of Dental Sciences, and I will be telling you about the examination part of the temporomandibular joint, the lymph nodes and the muscles of mastication. And my subject Nagarani will be helping me in doing this demonstration. Temporomandibular joint, as we know, is a very important joint in our body. It is a bilateral joint and it is unique in a way that it has a single bone, the mandibular bone, which joins both these joints together. Examination of this joint plays a very pivotal role in the clinical examination of an individual. We have two approaches to do this examination. One is either we are entirely behind the patient and the other is we are entirely in front of the patient. There are two approaches in which we can do. One is a preauricular approach where we place the finger in front of the ear, and the second is the intraauricular approach where we place the little finger touching the condyle on the inner aspect. When we are examining the temporomandibular joint, there are three entities which we are supposed to look for. The first one is the joint movement, and when we are doing this, we check for mouth opening, we check for deviation and deflection, and the third one we check for is the sounds in the joint. Now coming to the first one, when one opens a mouth, we usually check with three fingers. If three fingers are comfortably passing in, it means that the mouth opening is sufficient. When they cannot pass through, it shows that the mouth opening is not sufficient. In such instances, we can also measure interincisal distance using a divider and a scale. Usually when one opens a mouth in normal condition, the central part of the maxilla and the central part of the mandible should be aligned. But if they are moving towards the right or left, it denotes a deviation or a deflection. Deflection means when you open the mouth totally, one is away from the midline. Deviation is when in the process of opening, it deflects to a side, but in maximum opening, it is again in the central line. So we check mouth opening, we check deviation and deflection, and then coming to the joint as such, when we are palpating the joint, ask the patient to slowly open the mouth and gradually close it as well. We check for condylar movements if they are palpable or not, and along with that we also check for two sounds, that is crepitations and clicking sounds. Crepitations are multiple gravel-like sounds and clicking sounds are sudden pop-up sounds which we can hear or palpate at the joint. We have four major muscles of mastication. Speaking about them, the first one is the masseter, the second is the temporalis, and internally we have the medial pterygoid and lateral pterygoid. Let us now speak in detail about the examination of each of these muscles. The first one is the masseter muscle. The masseter muscle originates from the zygomatic arch, moves downwards and backwards and gets inserted into the lateral aspect of the ramus of the mandible. So this is the basic area of the masseter muscle. The subject is asked to clench the teeth. And when they clench with two fingers, we try to palpate the muscle, the taut muscle band which is there in between. This can also be palpated using an intraoral and an extraoral approach. This way the whole muscle band is palpated. We can also palpate it bilaterally, both the muscles in one go. The second muscle is the temporalis, which originates from the nuchal lines in the temporal bone and fan-shaped comes down and gets inserted into the anterior aspect of the coronoid process. Patient is again asked to clench the teeth and we palpate this band over here in the temporal region. Next is the pterygoid group of muscles. We have the lateral pterygoid and the medial pterygoid, both originating from the lateral pterygoid plate. The lateral pterygoid muscle, as we know, gets inserted onto the anterior aspect of the condylar process, and the medial pterygoid gets inserted onto the medial aspect of the ramus of the mandible. So let us just see where we need to palpate for these muscles. For the lateral pterygoid muscle, we need to palpate posterior to the last molar in the retromolar region, ask the patient to close the mouth slightly. Pterygoid, we need to palpate lower and posterior to the mandibular third molar. That is the area where this muscle gets inserted. Think about the lymph nodes. Lymph nodes, as we all know, are very important protective mechanism in our body which prevents the systemic spread of infection. The oral and maxillofacial region and the neck region encompass a huge number of lymph nodes, and palpation of lymph nodes could also be an early indicator in the detection of malignancies. Now, speaking about the lymph nodes in this region, we have the preauricular group of lymph nodes, the postauricular group of lymph nodes, the parotid lymph nodes in this region, the submandibular, submental group of lymph nodes, and the cervical group of lymph nodes. To begin with, let us start with the submandibular group of lymph nodes. When we palpate a submandibular group of lymph node, just feel the lower border of the mandible, go a bit on the mesial aspect, bend the patient towards the side you are palpating so that the platysma muscle is free, and then hold it against the inner aspect of the body of the mandible and feel for the lymph nodes. They are very easy to palpate if they are enlarged. Similarly, the next group of lymph nodes are the submental. Bend the patient completely forward and palpate it in that region. A lymph node, when we palpate, we should look for the site, the size, the number of lymph nodes, the fixity, tenderness, and the consistency of a lymph node. A hard lymph node by consistency and a fixed lymph node is a direct indicator of malignancy.